Hey everyone, today we'll talk about hyperkalemia periodic paralysis in short only. So basically, what is hyperkalemic periodic paralysis is? It is an autosomal inherited disorder that affects the sodium channel in muscle cells and the ability to regulate the potassium levels in the blood. It is characterized by blood hyperaccessibility or weakness which exacerbated by the potassium, heat or cold can lead to uncontrolled shaking followed by paralysis. Onset is usually in early childhood but it still occurs in with adults and mutation which causes disorders is dominant on skeletal muscle sodium channel with the linkage to the sodium channel expressed in muscles that mutation causes single amine acid changes in part of the channel which are important for inactivation and these mutation impair ball and change fast inactivation of sodium muscle channel that following an action potential. Here you can see the about symptoms and how it causes like rare disorder by paralysis. It only mostly affect on the muscle weakness and it characterized by fall in serum potassium levels. So we can see check the potassium level it's high or low. It should be not more, right? And it affects one in the 100,000 people and it's caused by the genetic mutation of potassium channels and symptoms precipitated by the exercise, certain food or inactivity. And 50% patient reports that recurrent migraine attacks and symptoms some are inability to move muscle or limb and weakness. Onset, like I already told you, in adolescence also diagnosed by long exercise tests and absent tendon reflexes, treated by the diet, lifestyle modification, and potassium supplements. Complications are permanent muscle damage and heart abnormalities. In short, you can see the difference between here hyperkalemic and hyperkalemic. Hyper 1 is usually present in the adolescence, and hyper 1 is attacks on the periodic weakness that provoked by fasting, stress after the exercise, or cold. Hyperkalemic attacks can be prolonged, usually occurring on awakening and accompanying. Hyperkalemic attacks are brief, lasting minutes to hours and accompanied by hyporeflexia, and hyper one by the hyporeflexia, and this one potassium is usually elevated during attacks. Potassium and hyper one potassium is low during effect, and hyperkalemic potassium is usually elevated during attacks. So we should um, check the potassium level must. Hypokalemic is possible to proximal myopathy, and this one is electrophysiology and is developed of progressive weakness during the adulthood. And myotonia is never present in hypokalemic, and hyper one is rarely associated with mild sensory axonal pyloneuropathy, and hyper one may not have myotonia between attacks. And about hypo in electrophysiology, you can say rarely associated with mild sensory axonal pyloneuropathy, never myotonia, and effects of cooling unknown. Short exercise test, no decrement. Long exercise test produce immediate increase in CAM, especially if initial is low, followed by the progressive decline in compound muscle action potential is low. It is followed by the progressive decline in, and it is about by the 50% over 20 to 50, 40 minutes, with most of the decline in the first 20 minutes. And the RNS is repetitive nerve stimulation that causes no decrement unless after prolonged exercise. And now comes to the hyperkalemic electrophysiology. It may not have myotonia between attacks and rarely myopathic units. Myotonia is seen in the attack but disappear as weakness progress. Muscle cooling has no effect. Short exercise test produce no decrement. Long exercise test produces immediate increasing in compound muscle action potential is low, followed by progressive decline in compound muscle action potential by 50% over 20 to 40 minutes, with most of the decline in the first 20 minutes. And repetitive nerve stimulation cause no decrement unless after prolonged exercise. Here you can see the symptoms like weakness or paralysis. Most commonly occurs at the shoulder, back, and hips, and may also involve the arms and legs, but does not affect the muscle of the eye and muscle that helps with breathing and swelling. Most commonly occurs while resting after activity or exercise. May occur on awakening, occurs on and off. Usually lasts 15 minutes to 1 hour, but may last up to one entire day. And it triggers may include like eating a high carbohydrate meal, rest after exercise, exposure to cold, skipping meals, eating potassium rich food, or taking medicine that contain potassium and stress. Diagnosis we can do. So healthcare should provide based on the primary several criteria that first include the family history of the disorder, which include a history of transit episode of weakness, equal serum potassium levels, electromyography, and exclusion of secondary causes. Other clues to the disorder are muscle weakness symptoms that come and go with normal or high result of a potassium test. Between attacks, a physical examination shows nothing abnormal. During and between attacks, potassium blood level can be normal or high, but during an attack, muscle reflexes are decreased or absent, and muscle go limp rather than staying safe. Muscles grow near the body, like shoulders and hips, are involved more often than arms and legs. So we can do some tests like genetic test, ECG, which may be abnormal during attacks, and EMG, which is usually normal during the attacks. And we can check the potassium level also. Management of patient consists in a medical therapy and avoidance of triggering factors that gender physical activity, ingestion of carbohydrate rich drinks, snacks, or inhaled salbutamol at onset of attacks may avoid them. Daily use of carbonic anhydrase inhibitors or thiazide diuretics helps in preventing attacks. Dietary advice include regular meals to prevent fasting and avoidance of potassium rich food. Now comes to the prognosis. With the age of generally after 40 years of age, the frequency of the episode declines, but some patients may develop chronic myopathy of variable severity that may cause permanent muscle weakness. Thank you very much. If you have any doubt, so please ask.